Hello, my name is Dr. Cheryl Burdette, and I'm the director of the clinical educational component of Origins Incubator. And this week we talked about POTS syndrome, postural orthostatic tachycardia syndrome. And we looked at why a functional approach is so helpful in terms of dealing with these symptoms. We know that we're seeing it more often. It's a common sequelae, status post-COVID. And so when we think of it from a functional medicine approach, we aren't just thinking about increasing neurotransmitters. We aren't just thinking about acetylcholine or maybe epinephrine and norepinephrine, but we're also thinking about the health of the tissue. And when we pull that into consideration, we're thinking about what's the health of the adrenal glands that make epinephrine and norepinephrine, sending a signal to the vessel to tell it to constrict when we go from sitting to standing. And then we're also able to bring in consideration of the health of the vessel itself. And so this is why integrative therapies can be so nice adjunctively, because when we think about, okay, what can we do to make the vessel more responsive? There are a number of nutritional interventions that help with us here. So in this case, this was a mom who's very busy. She was a physical therapist. She had done tons and tons of exercise in her past and really enjoyed that component of her lifestyle, but was suffering from a diagnosis of POTS. And so we looked at the fact that extreme exercise can be a reason for adrenal fatigue. And so if adrenals are weaker, not making the epinephrine and norepinephrine that she needs to send a signal to the vessels to cause them to constrict. And then we talked about some of her other gut-based symptoms. And so she had antibiotic use in the past and was currently experiencing more bloating and discomfort. And so we can look at this and think about potentially yeast overgrowth or bacterial overgrowth, but a reason for more histamine, which often occurs with POTS. And so we thought about individualization in this case in terms of her gut-based treatments, treating the yeast, but then also thinking about anti-inflammatories for the gut like quercetin that can be more effective than cromolyn in terms of decreasing gut-based histamine. Then we thought about the vessels and what we want to do to increase integrity. And so there are bioflavonoids that have shown really important data in terms of being able to do just this, to increase the integrity of something called the glycocalyx inside the vessel. And this glycocalyx sends a signal to make more nitric oxide. Well, one of the problems in POTS is that nitric oxide is not being created like it should, so we can use bioflavonoids like diosmin that have been shown to increase nitric oxide, but also have really good data in terms of inhibition of mast cell production and decreasing mast cell degranulation. So we thought about the individualization in this case, some of the diagnosis in terms of mast cell disorder, and thought, what can we do to both improve the integrity of the vessel, but also deal with the histamine that's an issue here. We looked at other indicators in her history, changes around her menstrual cycle when she would be worse, and talked about some of the research around progesterone. And it turns out that symptoms of POTS are worse during the first half of our menstrual cycle when progesterone is lower, and get better in the luteal phase when progesterone is higher. So talked about some of the tie-ins there in terms of vascularization and helping with histamine. And finally, we looked at ways to improve her own nitric oxide. So when we apply a functional medicine lens and think about the advantage that gut-based practices are going to give to us in terms of lowering histamine, and how we have the advantage of being able to do things like strengthen adrenals and strengthen vessels, we're feeling very optimistic about this outcome in this case.